Hi, I'm Ashley Cooley, a birth, baby, and sleep specialist and mom of 3. There's so much information out there, right? This show is dedicated to helping you clear out the noise so you can figure out what will work best for your baby and your family. If you're looking to learn more about your baby, gain more confidence in your parenting, and get as much sleep as you can through it all, you've come to the right place. Bringing up baby is about to get a little easier. Hey everybody, welcome back. This is Ashley, and today Kelsey's back. Kelsey Marr is a birth researcher and doula, and she has been a wonderful resource to the Bringing Up Baby podcast because as a birth researcher, she's been bringing a lot of the actual research. What is it saying about these particular topics? And then we both talk practically of like, okay, now that we know what the research actually says, not just blanket statements by public health, which are also very important guidelines. But we're talking about what the research says and how to practically apply this to our own situations because, well, nothing's ever really black and white. So without further ado, here is my conversation with Kelsey about alcohol and cannabis as it relates to pregnancy and breastfeeding. These questions come up. They don't come up so much for me or to me as it relates to pregnancy. I find it's more postpartum and like alcohol and breastfeeding. Nobody typically asks about cannabis, but I do offer the information to which there is not much, but I still have a conversation around it because it is legal in Canada now and lots of other parts of the world. So I'd love to talk about those two as it relates to pregnancy and postpartum of what are the recommendations or what is the science and research behind alcohol in pregnancy and cannabis. And then, well, we can start there and then maybe talk postpartum later because that could be a different story. But what are you seeing and reading and learning?
Yeah, so I think, and maybe this doesn't come up so much in your prenatal classes, or really, I mean, now that I'm reflecting on it, it doesn't often come up in my prenatals with clients either, because so many of us have just absorbed the messaging around the fact that we aren't supposed to be consuming alcohol. And I'll speak specifically I think to that. Alcohol is a different story than cannabis. I think like our relationships, just like societally are different to them. Yeah. And so like, there's just been, for at least my lifetime, we'll say, a very, very, very strong public health messaging against the consumption of alcohol during pregnancy and concerns early on in pregnancy about miscarriage. But then we see, you know, a lot of the messaging, a lot of the stories we're told are about alcohol causing fetal alcohol syndrome or causing developmental issues for the infant after alcohol has been consumed during pregnancy. And then I think part of it too, I don't know if this was your experience, but I'm finding being 20 weeks pregnant right now, like certainly during the first trimester, I did not want alcohol. I was quite nauseous and sick. And now it just kind of like doesn't interest me. It's not that like I think I shouldn't be drinking alcohol at this point. It's just kind of like,
but why? Yes, but why?
But I do think like there's nuance in this discussion around alcohol and pregnancy that in the evidence, in the scientific research, that doesn't necessarily get captured in that public health messaging. And I think part of it is one, like our public health recommendations are made to cover like a huge variety of people and a huge variety of lifestyles. Yeah. And what's often easy is like we set the bar at the lowest possible threshold. And that's the messaging we put out for the safety of, you know, as many people as possible. And I think the other thing is that the research around alcohol or cannabis or any other type of drug consumption during pregnancy can be really hard for researchers because we're trying to isolate certain variables in people's lifestyles. So,
and how easy is it for them to get those who are pregnant to do studies around,
right?
Hey, you
so
should consume alcohol.
There's two things. There's one is like, we're not going to do a randomized controlled trial where we give some people glasses of alcohol while they're pregnant and others not glasses of alcohol while they're pregnant, and try to figure out, what the difference of outcome is just based on that. Usually researchers and funders are pretty reticent to offer pregnant people, illicit drugs or monitored drug or any sort of drug to see what the outcome is. And so because of that, most of the data we would have for these types of questions, does alcohol cause this or does cannabis cause that, is observational data or retrospective data. So it's like people telling us about their own experiences. And so I would have to tell you, if you were the researcher, did you consume alcohol during your pregnancy? Yes or no? How often did you consume alcohol? And like, I don't know about you, but anytime I go to my doctor outside of my pregnancy and they're like, when was the last, or how often do you drink alcohol? And it's
they're asking that in your prenatals?
Not in my prenatals. I went to the doctor before I was pregnant.
Okay.
They did ask during my first prenatal if I consumed any alcohol up to that point.
Okay.
But like whenever somebody, like a doctor or somebody asks you questions like that, it's like, well, I don't drink every week, but some weekends I have like 4 or 5 drinks, and then I could go like several weeks with no alcohol. So like, how do you answer that question? Yeah, right.
Sure.
And so I think all of that really like complicates this story of like, what really is the relationship between, say, alcohol and these outcomes that we are concerned about when we're consuming it during pregnancy. What the research is actually showing us is that the risk of consuming alcohol at low levels during pregnancy are very low. And so by low levels, I'm talking about standard drinks. So like 12 ounces of beer, 4 ounces of wine. I'm not talking like
what your husband would pour for you. This is a different story.
Or, if you're drinking the big tall boy can of a 7% beer, like that's a different story than what we're talking about here, right? We're talking, 12 standard ounces drink of a standard lager. But in the first trimester, a couple of drinks a week is not having any negative impact on baby's physical or mental development. In the second and third trimester, we're seeing, like the research is reporting, up to 1 standard drink a day is not having negative outcomes for infants' development.
Okay. I'm glad you broke that up into trimesters even, because we do, personally, as somebody who was actively looking to get pregnant when I wanted, right?
Yeah.
And we were trying and we were struggling and there were some miscarriages. And so I inevitably went the route of like, okay, how can I make my body as healthy as possible? Yeah. What can I be doing? Side note, I now know that my husband should have been doing more things too, because I'm like, oh, it's the male that they produce the placenta. Oh my God. So anyway, another topic, another day. But I do hear from lots of people who are maybe trying to conceive, or while they were trying to conceive, of abstaining from alcohol to get pregnant. Or we all know by now, because you and I've talked about it a couple episodes back, that the time that you realize or can figure out that you're pregnant, you're already a few weeks pregnant. Yeah. And so, oh my gosh, what about those drinks I had last weekend? I found out that I was pregnant with my first child while I was hungover that morning. And so it's like, oh gosh, guess I shouldn't have had those last night, but I didn't know any better. And so I did like kind of like, oh crap, like, I gotta worry about this now, my whole pregnancy. So I find it can be worrisome, because for someone who's trying to get pregnant, who's maybe like, of course you can do whatever you want in terms of like keeping yourself well and having a healthy body for your pregnancy, but definitely some anxiousness around that.
Well, and I looked into the preconception research last fall, actually, because we went to Mexico for my older brother's wedding. My sister-in-law is from Mexico. And then we came back and we discovered we were pregnant, not with this pregnancy, with a previous one. And I had a fun time in Mexico, and I came home and I was like, oh crap, have I
right,
flip the table on this situation. And so what I found in looking at the preconception research is that drinking alcohol, if you're trying to conceive, can impact implantation. So
in a negative way.
Negative way.
Right. Okay.
So if you were to drink, and I can't tell you how much alcohol, I don't remember, but if you were to drink and, have sex and sperm meets egg, it's unlikely that developing cluster of cells would implant. So you would experience it either as your pregnancy or as your normal period, or you would never know that had happened.
But wait, should we disclaimer this somehow? Because making sure no one listening is like, oh, if I'm drinking and have sex, I won't get pregnant.
Oh yeah, so that is also like we're talking about like levels and degrees of risk here within scientific data, right? Like, alcohol is not a good contraceptive choice.
Thank you. Okay, good.
That is not what I'm saying. I'm saying that it could impact that implantation process. The other thing is, so because of that, like if you were to actually conceive and get pregnant having consumed alcohol, there's not going to be
that
like
issue obviously
huge
wasn't
developmental issues with that child.
Got it.
We've skipped over the implantation issue.
Got it.
That baby is not going to have any issues. That said, once you are pregnant, we know that like the first couple of weeks of development are crucial. And so like heavy consumption of alcohol, binge drinking, could lead to either a miscarriage or it could lead to developmental issues with that baby. So in saying, like a low level of drinking of standard units of alcohol during the first trimester, slightly higher rates during the second and third trimester, again, in saying that those are scientifically, what the researcher is telling us is that that's safe for your baby's development, that is very different than heavy drinking or binge drinking. Yeah. And binge drinking, like in the second or third trimester, binge drinking, like consuming multiple drinks during a short period of time, the research is showing us that it doesn't matter the frequency. So like if you binge drink once during your pregnancy, that could lead to negative outcomes.
Okay. It's not like, oh, I only did it once, so my chances are low. It's actually, well, if you do it a lot, that one time, you could. Yeah. Okay. Really good to know. I partially wonder, I'm sure, and I know there's lots of reasons for, or potential reasons for not feeling well in the first trimester. But I have to wonder, just in us talking about this, like, I wonder if that part of it is the body's way of making sure that you're on top of things. Like, what's coming in, what could go out, not what goes out, but like what's coming in, and is it helpful or detrimental to what's coming?
This is another thing that like further complicates this type of research, and I haven't seen it specifically discussed in reference to alcohol, but I have seen it in researchers discussing coffee consumption early during pregnancy, and that one of the confounding factors that we see in the data is people who experience higher levels of nausea early in their pregnancy are less likely to miscarry. Just statistically, that's not a causal relationship, but it's a statistical relationship. People who are more nauseous earlier in their pregnancy are less likely to drink coffee because coffee upsets your stomach and it's gross and it's whatever. And so then there seems to be a correlative relationship between drinking coffee and miscarriage, but it's like a correlative relationship.
But is that because they're feeling
positive.
well?
Exactly.
And is that because so they're just correlated? Well, still interesting though.
So it could be a similar relationship with alcohol.
Yeah.
I mean, one of the things that we do see with alcohol consumption, and it's interesting if we look at studies done in Europe versus the US, because social relationships to alcohol are very different in Europe than in the US. In the US, we see a lot more binge drinking. In Europe, we see a lot more of, your 4-ounce glass of wine with dinner. And so when we look at kind of those two populations, even though in Europe there's a stronger social relationship to alcohol and people are more likely to drink during their pregnancies in Europe than in the US, we see we don't see an increase in negative outcomes or fetal alcohol syndrome in Europe versus the US. In fact, the rates are higher in the US than they are in Europe.
Because of the binge drinking, likely.
Yeah.
That's interesting. I never really considered that because I know, and we'll talk about this next when it comes to breastfeeding or postpartum and having drinks, specifically as it relates to breastfeeding, because I guess if you're not feeding your baby from your body, then your body is just yours again. Yeah. But I know that was one of the factors of the government in Canada basically coming out and saying that, hey, there's parameters around it and we'll talk about it, but it's okay if you have a drink. Yeah. What we're talking about is standard drink while you're breastfeeding. And when the Canadian government brought that onto everyone's plate, hey, look, we can do it, because at first it was no drinking while you're breastfeeding, but oh look, they're doing it in Europe. No, look, but it looks different how they're doing it. Yeah. So this question comes up as it relates to when we're in our feeding class, is hey, can I consume not just alcohol, but it's can I have sushi again? Do I have to have a stellar diet? But inevitably this question comes up, and we even have there's even a pamphlet here. The Nova Scotia local government has a pamphlet on it, but it is talked about. And so maybe we can talk about that, of how that maybe differs once baby is earthside, and again, specifically if you're breastfeeding or chest feeding, so milk is coming from your body, and how what does that research say?
So the research that I've read most recently is that it is fine to drink. Again, we're talking about standard kind of units of drinking. We're not talking about binge drinking while you're breastfeeding. And there's a couple of factors for that. Even if you were to drink heavily, before that alcohol gets to your baby, it's going through your liver, and then it's going through your blood system, and then it's going through your milk production system. So if your blood alcohol level is, I don't even know what the legal limit is, 0.8 or something, it's quite low, right? If your blood alcohol level is 0.8, and if baby were to get that full amount in your breast milk, baby would be receiving 0.8% alcohol through the breast milk, which is very, very low, right? 0.5. And again, I'm picking a number, 0.8. I can't remember if that's actually the legal limit. Yeah. I'm just using a number as an example. But 0.5% alcohol is kombucha, right? It's considered non-alcoholic. Yeah. It's not going to have an effect. Now, I understand there's concern because baby's development is obviously different than in an adult brain. Yeah. But no, we're not seeing those high, again, to get to 0.5 or to 0.8, you would have to drink very heavily to have that be your blood alcohol content. So we would be passing such a low amount of alcohol to baby that it's not showing that it's actually affecting their development. What I'm seeing in the research, and actually what I'm hearing from doctors and scholars in the field, is the bigger concern when you're drinking is not whether you're passing alcohol to the baby through your breast milk or chest milk. It's are you capable of looking after that baby safely?
Mm-hmm.
So do you have the capacity to make sure that your baby is in a safe sleep situation? Do you have the capacity to make sure you're not going to drop your baby or fall down the stairs while holding baby?
Yeah.
So it's more about your own capacities than it is about whether the alcohol is in the breast milk.
Totally. Looking for the best for your baby? Atlantic Canada's Baby Store is here for you. Nurtured, which is right here in Halifax, Nova Scotia, has the best products for baby. The staff are so incredibly helpful, and they have the most top-rated car seats and strollers you won't find anywhere else. So whether you need expert advice or the perfect baby gear, Nurtured's got you covered. Nurtured, supporting your parenting journey every step of the way. It can be interesting too, and always cautioning people about this as well, whether you already know this or not. But if you have been mostly abstaining from alcohol in your pregnancy, and then the first time you go and have a drink of something, I remember that time for me, because I'm somebody that there's a particular meal or two that I have where it's like, ooh, this would be nice with a little glass of wine with it. So when I'm having that particular meal that first time after having a baby, I planned and I was breastfeeding, so I gave her a big feed, as big as I could before the meal. Yeah. And she's having a snooze, so it was great, and I'm having the meal, and I'm drinking my standard glass of wine. I didn't even drink all of it before. I was like, woo, I feel that. Like, so I noticed, so I'm like, I wouldn't be able to ingest the same amount that I would pre-pregnancy and feel okay. Yeah. So gotta be careful of that. But I remember that particular meal and my first baby, and she's a week old. And as soon as I put my fork down, she's waking up and showing me she's hungry. And I was like, oh no, like, what do I do? Yeah. But I and I did, picked her up and fed her. She didn't get that same glass of wine that I just ingested. She didn't like pass out from the alcohol content in my blood or in the milk. And so practically speaking, like, while it's, again, we don't want to binge drink, or if we're planning to do something like that, we want to have a backup or have pumped or something like that to plan. But even still with this information, lots of people come to class and ask about, because Amazon sells them, these little test kits to test the alcohol level in your milk. Should we get those? If you have to test the alcohol level in your breast milk, and maybe because you had a bunch to drink, so maybe just wait a little bit longer before you do that, right? Yeah. But what's your take? Would you ever suggest to somebody or recommend those things?
I would recommend moderating your alcohol consumption before I would recommend testing it. Really, like, again, you would have to drink a lot of alcohol for it to be in your blood. Yeah. For your blood alcohol level to be high enough for it to affect baby. Right. That said, like, if you are going to be if you feel that you need to be so cautious as to have those test strips, do it. But maybe that level of caution tells you that it's a better choice for your mental health, for your physical health, not to drink at all. I see a lot of people, including doctors in the States, because again, the States has a different, even though Canada and the US are similar, we do have different relationships to alcohol, and different relationships to, particularly to alcohol consumption during pregnancy and postpartum. And I see a lot of, doctors or chiropractors who are doctors, but talking, it always seems to be like it's chiropractors who are the doctors on social media who speak outside of their area of expertise. Right. But promoting pump and dump. And you certainly don't have to pump and dump if you have, by which I mean, like, pump your breast milk and dump it out, throw it away instead of feeding it to your baby because you've consumed alcohol. Yeah. You certainly don't have to do that. Again, the risk for your baby is very, very, very low. Yeah. But if for some reason that feels right to you, that is an option. Like you said, make sure you have other options on hand, whether that's having pumped milk stored if you're going to go out and have a few drinks, or having formula on hand. again, if you are going to drink heavily, I would actually suggest having another caretaker on hand. Because the risk is more about your caretaking capacities than it is about the alcohol.
Yeah. I think we can safely say, because alcohol's been legal for a long time, long enough that there are multiple studies and results have been replicated, and we may not be able to get exact numbers. I'm sure, much like epidurals and stuff, the way our body takes it in and processes it and that sort of thing, I think there's an average of 2 hours per drink, give or take, it leaves your system. If it's in the contents of your blood, it's in the contents of your milk. But where that's been well researched, we can confidently say, like what you're saying, that like these small amounts are not going to cause any harm. What's not well researched, though, but is legal, is cannabis. So while no one has ever, and maybe because, like you were saying earlier, Kelsey, like we have a different relationship societally with alcohol versus cannabis for the most part. But I usually just offer this information to people if or when they ask about alcohol, because I'm like, hey, it's another drug that's legal. Enough people do it, so let's just get some info out there. But there's not a lot of info because it hasn't been researched, and it's probably real hard to get that researched. But I'm sure there will be some at some point. But what do you see and learn about that?
So I get asked about cannabis actually quite frequently, and I think maybe it's because I'm having one-on-one conversations with people instead of a classroom setting, because like I'm 34 this year, and so for most of my life cannabis was an illicit substance, and I still do think for people of like our age set, the people of the age that we typically work with, like there is still this relationship where like maybe you're open about your cannabis use in your everyday life, but somehow during pregnancy or postpartum, it feels different, right? It's still carrying that history for, like, if I smell cannabis while I'm out for a walk, I still think, like, oh, somebody's having a really good time, right? Like, rather than, like, there's still that relationship.
But I think, because you can have, like, people who are a little bit more open to the alcohol with breastfeeding or alcohol in pregnancy.
It's been around longer.
Yeah, you're going out to dinner with, oh, would you like some? Like, they'll actually maybe offer you some, because they're like, hey, some pregnant people do that, and I guess it's okay, but nobody's doing that with cannabis.
No,
whether they're pregnant or postpartum. So very
But
interesting.
the questions I do get about cannabis are often because people use cannabis in a different way than they use alcohol, right? So there are people who use cannabis recreationally. There's also people who use cannabis medically, right? And whether or not they have like a medical prescription for it, like I get a lot of questions about from birthing people who use cannabis to manage their anxiety or their depression, and is it safe for them to do that, especially knowing that like pregnancy, postpartum, the whole perinatal journey is a tumultuous time for mental health for many people. And so what I can say, what I found looking for my clients who specifically are looking to use cannabis while breastfeeding for this reason, is that most of the data we have is more than 15 years old. And so it's not that old data is not credible. It's that not seeing studies replicated raises questions for researchers about why those studies aren't being replicated. Does it mean that they like something was wrong in the study design? Why is it that we don't have more recent data?
I mean, is it because it's been illegal though? Like, how do you research something that's...
So part of it is because it is what has been an illicit drug, and like that comes up to other factors where like because of the illicit nature of cannabis historically, the studies that we have are compounded by the use of other illicit drugs. So people who have been used or have been open, at least with researchers, about their use of cannabis during breastfeeding or pregnancy have also had other substances which then confound the data. We don't actually know.
We don't know if it's cannabis,
or if it's something else.
Got it.
The other factor is, of course, what we already talked about in terms of getting researchers or funders to do research on illicit substances or even non-illicit substances. Like, nobody's gonna
and go find your participants.
Go
hey,
find your
anybody want to volunteer
to potentially do a blind study on cannabis?
Yes.
Right?
Yeah.
But what we do know is that, like, a recent study, a 2023 study, found that maternal cannabis consumption significantly altered breast milk consumption. So it decreases the immunoglobulins in breast milk and increases the lactose. So that, because, like, one of the major reasons that people want to breastfeed their baby is because of the immune benefits to doing so. Basically, if a breastfeeding person is consuming cannabis, that can have detrimental effects on the infant immune function as well as their digestion. We also know that THC passes through breast milk and it stays detectable within the breast milk for 6 days after consumption. And I will say, like, these studies as well are based on consumption via inhalation, so smoking cannabis. Right. I actually haven't found any data on edibles and such, edibles or other or vaping.
There are, I didn't even consider
because all of that, like, affects. My understanding is that all of that affects how the body is processing the elements of cannabis. And then we also know that cannabinoids. That's the word. Yeah. I can't say it. Have metabolites that we're finding in breastfeeding infants' feces. So those are also being passed to baby. No, so we know that these things are being passed to baby. What we don't know and we don't have data on is the long-term effects of baby. Right. So we don't know how they're affecting babies. From what I can tell in the research and what I've seen so far, we don't know how it's affecting baby in the short term. We definitely don't know how it's affecting baby in the long term.
Right.
That all said, there are recommendations from a number of public health agencies. So Health Canada, the CDC in the States, and other health agencies, that if your only options are breastfeeding and not using cannabis to manage a mental health condition, or giving up breastfeeding so that you can use cannabis, do both. Use cannabis and breastfeed. Because the benefits of breastfeeding. Because the benefits of breastfeeding are so high, and because the negative detrimental effects of not managing a maternal mental health condition are so high. So if those are your options, if there is for some reason that alternative mental health treatment is not an option for you, and what I will say is we have much, much better data on how pharmaceutical mental health medication affects babies than we do on cannabis. Again, we run into issues with people not wanting to give pregnant or breastfeeding people these medications, but we do have data that has been collected on many of these medications during those uses.
Generally speaking, without doing a whole new episode on this, because we could, I'm guessing that many of them are safe for baby.
There are some more than others that, like, if you have a mental health condition, if you're experiencing anxiety, depression, a postpartum or perinatal mood disorder, there are medications that your doctor can recommend that we have data suggests they're safe for baby in utero, they're safe for baby during breastfeeding. And again, breastfeeding on a medication, you're looking at the medication level in your bloodstream, so the amount being passed to baby.
Crossing some barriers there.
Crossing some barriers. It's also the amount, like, I'll speak from personal experience. I'm on a medication right now that I was confident to use during my pregnancy, but concerned about using while I was breastfeeding. And I raised that to my doctor at my last prenatal appointment. And she said, well, actually, the amount that your baby is going to get through your breast milk is substantially lower than what they're currently getting in utero.
Okay.
Yeah.
Do you feel like having been and are a researcher, do you think they're going to find a way to study this cannabis stuff? Because these questions coming up already, where it has been an illicit drug for so long, but obviously many Canadians didn't care. And going in this direction. So I'm just curious your thoughts.
What I'm seeing, like, in the research is a lot of researchers pointing out how important it is to get this data and do this research because of these questions about mental health and how people are using the drugs or using cannabis. What I also am seeing is, like, to use COVID vaccines just as an example of a medication that was recently trialed with pregnant people. Because they did not initially want to trial or include pregnant people in the clinical trials for the COVID vaccines.
I'm sure they didn't start there.
It started a big conversation about the agency of pregnant people, or the right of pregnant people to choose whether or not they participate in clinical trials. Again, it's a little bit different when it's a vaccine versus cannabis, but
Still,
there is
though,
this ongoing
it's scary.
discussion.
You're pregnant. You're nurse, like.
But if you want to have that option of getting the vaccine, whether or not you should be able to make that choice for yourself. The other thing is, we saw a lot of people. It wasn't a randomized controlled trial, but pregnant people who volunteered to get the COVID vaccine. And once we had enough people, the study I'm thinking of was 40,000 pregnant people in the United States who volunteered to get the vaccine and participate in this trial so that we had data on how the vaccine affected pregnant people. And so there might be options in terms of, like, how studies are designed so we get that information going forward.
Well, that makes sense. I'm very curious where that's going to go. Just anytime there's something new to talk about, because there's still, well, as you and I've talked for a few episodes now, like, research says X or Y or Z about this topic, that topic, but there's still so much to learn. There's still so much to get at.
And I mean, research, there is an element to research where, depending on the quality of the study, depending on the study design, we can find research that kind of
supports
anything, right? And so it is understanding, one, that every research study, whatever that study's about, is coming through a particular bias and a particular lens. There's different research designs that are more reliable than others. But also, you are still making a decision for yourself. No matter what the research says, you need to, like, an informed decision. To make an informed decision doesn't just mean to know what the evidence says. It's to have the ability to interpret that evidence and weigh it against your own values and your own context. And so I'm not saying smoke cannabis while you're breastfeeding. I'm also not saying don't. Like, this is what the research says. But that's a decision that every person has to make for themselves.
Exactly. Well, and I appreciate you bringing that research to us, because these are the things that people are Googling. And like you just said, you can find evidence, whether it's actual research articles or somebody's opinion or what the media took from research, and it actually is not the actual truth or findings. Like, there is that stuff that we have to sift through. And so I find it can just make us more anxious. If I'm like, I'm looking for something to go against what I'm saying, or usually we're looking for proof of what we think of something, but like, sometimes I'm like, I want to see what's going against what I'm thinking and see, is that valuable information, or how do I take that in? And then we can still just throw our hands up and be like, well, holy shit. I still don't know what to do.
No, and you just gotta, like, there are certain things that I have realized during my own pregnancy that I just end up going with my gut. Because I can't find, there are things that you are not, I mean, cannabis being an example, we don't have good research, we don't have good data. You kind of have to do what feels right to you.
And knowing such a valid point too, especially when it relates to mental health and well-being of the parent. That truly is, we obviously, yes, we want anything that's going to our babies to be good for them.
Mm-hmm.
But the ultimate thing that babies need is a healthy, happy parent. Absolutely. So that they can be as well. So that's such a valid point to make.
Mm-hmm.
There's more than just what the research is telling us.
Absolutely.
If you're looking for more information or support along your parenting journey, check out birthbabysleep.ca. That's where you're going to find prenatal classes, postpartum and new baby resources, and sleep support during the childhood years. Lastly, but certainly not least, if you got something out of this episode or our show in general, leaving a rating or a quick review goes a really long way to helping others find us. So please consider leaving one. That's all for now. I'm Ashley Cooley, and we'll see you back here next time.